It's a popular procedure with a funny name. It's the bingo wing, the upper arm lift. The cosmetic surgery has increased more than 4,000% in the last 12 years. And as Night Beat's Jim Bergamo shows us, many choose the procedure because of another life-changing decision that they've already made.
I walked around most of my life feeling like a outcast.
It's hard to imagine, looking at her now, that 5-foot-tall Marcy Evans of Manor used to weigh 250 pounds.
As an overweight person, looking in the mirror, I always felt like that wasn't me. And
3 years ago, she opted for gastric bypass surgery. It's allowed her to shed 125 pounds, but
you have this idea of, I'll lose this weight and this is what I'll look like. And that's not what happens. You trade one physical problem for another.
Even though the pounds are gone, they've left behind an unwanted parting gift, several inches of extra skin.
One is actually behind the arm. Bring your arm up for me.
Evans came to see board-certified plastic surgeon Rocco Piazza to get rid of the excess skin. The procedure is called brachioplasty, or upper arm lift, or even bingo wing surgery.
Would this be something that you would normally wear when you're, okay, why?
Because I don't want to show that.
The increase in weight loss surgeries resulted in patients that have a lower body mass index, a BMI, they're healthier, they've got less medical problems like diabetes and high blood pressure, but with that comes the excess skin that resulted from having such a huge amount of weight.
When you have these arms, you not only wave once, you wave twice because your arms flap.
Piazza says some patients opting for the upper arm lift are driven by the look of famously toned arms, like those belonging to Michelle Obama. But the First Lady works out regularly, and Piazza says maintaining good muscle tone is key.
We can remove the excess skin, but if the muscle tone isn't there for the biceps and the triceps, and the patient isn't exercising and really working on the underlying muscle development, they're not going to have Michelle Obama arms. Go ahead and flex your biceps for me.
Piazza says the one negative to the upper arm lift, or any procedure involving removing so much excess skin, is that it will leave a scar. In this case, from the elbow to the underarm. Evans says it's a small price to pay.
Some people talk about, well, you'll have a big scar. Well, I have a flappy arm. A big scar is not going to make any difference. I'm okay with that.
Dr. Piazza says the cost of the procedure includes both arms. He says the price ranges anywhere from $5,000 to $11,000, depending on which plastic surgeon you choose. For more specific information on the procedure, check out the link at the end of this story on KVUE.com. Jim Bergamo, KVUE News Night Beat.